Addressing the launch of the NHI registration on September 1st, Minister for Communication and Works Mark Vanterpool gave a moving account of his own experiences on a number of occasions when he was approached by persons seeking thousands of dollars to access health care for themselves or family members.
3 3/4% of your wages you may be concerned about. But I have more concerns than that, because I have had very personal experiences on a regular basis up to this year many times. And I have had on many occasions, they will testify to you, not just now, not just since I've been in politics, but I have had on many occasions to dip my hand in my pocket when sometimes I couldn't even afford it. And I'll go around and call up on many friends urgently, within hours sometimes, to raise $5,000, $10,000 cash.
The politician and business owner reprimanded private insurance companies for denying their members coverage when their health status changed, especially during their senior years.
They're dodging and ducking, paying out for health insurance bills as much as they can. And you know that when you go, and this year you have some situation that you can't handle, or you know that you have some disease that you have just discovered, or you know that you have just seen a lump in your breast, or you have just been told by the doctor that prostate is on the way, and you know that when they discover that next year your health insurance is either denied or the premium is seriously increased. You know how to operate. Ladies and gentlemen, understand that under the National Health Insurance Scheme of the Virgin Islands, you will never be denied coverage. No matter how old you get, no matter how sick you get, no matter where you are, your coverage is always there under this. You bring another insurance company to me and show me that one that will give you that kind of coverage, and I will say, go ahead.
In response to questions about the effect NHI would have on private insurance companies, Professor Emeritus at University of the West Indies, Dr. Carl Theodore, said private insurance companies can provide complementary health packages for residents in the BVI. In a GIS interview, Dr. Theodore asserts that nowhere in the world NHI has put private insurance companies out of business, adding that such companies are thriving in other countries with the same NHI model.
What the insurance companies have been doing all over the world, where you have these NHIs, is that they look at the packages carefully, and they look to see the kind of things that the people need, people think they might want, and they come up with very attractive complementary packages, and they're doing very well. I mean, in the UK last year, claims, private health insurance claims exceeded £1 billion. In Canada, a few years ago, when they measured it, the Canadian private health insurance, they were doing at the level of $45 billion. These are not small numbers. These are saying that here you have cases where you have NHI in a strong sense, and yet the private insurance is admitting. That means it's possible for the insurance companies to look carefully at the packages and say, well, look, this is how we're going to copy it. We will supply this.
So then what do we say to people who say that they can't afford both? Maybe persons say that they can afford NHI, but then they don't want to pay for a supplementary package.
Take France. In France, it's an interesting figure. In France, they have a social insurance system, but 92% of the people in France have some kind of complementary package. You see, I think it's people realize that health is an important thing to them. And when it comes to putting aside a little bit more to make sure they get the health care, I think people are going to do it. People definitely find those that if once you offer them something that looks attractive to them, they are going to prioritize and go for it. And that is the experience we're seeing elsewhere, and there's no reason why it really shouldn't happen here. I mean, people find that extra for it. So there's no question that the insurances will go out of business. That does not happen anywhere.
Right.
We have never seen that happen. The NHI has never pushed the private health insurance out of business. Nowhere in the world it has happened. And there's no reason why it should happen here.
Minister for Health and Social Development Ronnie Skelton has stated that the national health insurance is not only more cost-effective and affordable for the wider population, but will have significant long-term social and economic benefits for the Virgin Islands. He also said the public education campaign will continue to be rolled out over the next several months to provide more information and address new concerns about NHI. Employer and employee registration process began on September 1st and is ongoing. Residents, once registered, can begin to access healthcare services through the NHI from January 1st, 2016. You can visit the NHI website, vinhi.vg, or their Facebook page to find out more.